Good morning, Ma'am Bening. So today we are going to present our English midterm project presented by Group 10. Before I start our presentation, I'll introduce my member for this midterm test. The first member is Ayu Indah Lestari, and then second member is me, Fidel Rachman, and then the third one is Dinda Gethsela. So this is our situation. The patient is transferred from the emergency department to the intensive care unit after being treated for a severe stroke that caused by brain hemorrhage. The patient is stable, but part of his body are paralyzed. So the condition from the patient is, you can tell it's getting worse because the patient is moved from the emergency department to the intensive care unit. So on this part, I will tell you about what is a hemorrhage. Brain hemorrhage is a type of a stroke caused by a bursting artery in the brain and causing a bleeding in your brain. So if you can see from the illustration right here, you can see that the artery is bursting and it is causing bleeding in your brain. So the condition from your brain is bad because your brain will be full of blood from the bursting artery. Hemorrhage has 4 types of hemorrhage and has so many symptoms. The first symptoms is headache. You can feel hurt in your head and then drop your eyelids. You can tell the eyelids from your eye is drop a little bit and numb from your parts of your body, usually in your foot on your hand. And the last symptoms that usually hemorrhage is neck pain. So if you have these 4 symptoms, you should check to the doctor. So we move to the hazard and risk from the situations. The first hazard is the stretcher and the transport process. The stretcher is the tools that will use from the emergency department to the intensive care unit, and then the risk is falls during transfer and bump into a person. So in hospital you can meet anybody and the process transport is going fast, so it will be important to move the patient fast so you can bump into a person in the hospital. And then the second hazard is immobility, and then the risk is bed sores. Immobility is because the parts of the body on the patient is paralyzed, so the patient cannot move very well. They have to bed rest, and the long time if you bed rest, you will have a bed sores. And the third hazard is medication, and the risk is high risk medication complication because the patient have a many complication disease like the artery bursting artery paralyzed, so it will give you so many medication. So medication complication is one of high risk in this situation. And then the last hazard is paralysis, and the risk is choking on foods or fluids. So if your parts of your body cannot move very well, paralyzed is when your strength, your body is weakened, so it have a chance choking on foods or fluids. Next.
So I'm Ayu and I wanna tell about the assessment they're using. So we made it into 3 parts. The first one, it assesses about the consciousness and brain function to guide neuromonitoring and urgent care. So they need to check if there has to do an urgent intervention if needed. So there's a kind like neurological assessment like the Glasgow Coma Scale and pupil check. And then the second is monitoring vital sign, helps assess stability and control blood pressure to prevent further stroke and complication. So the vital sign monitoring kind of check about the heart rate, respiratory rate, and oxygen saturation. So there's like they need to do prevention if there is a bleeding or infection in the head. And the third one is assesses about motor deficits to guide physiotherapy and tracks recovery progress. So it's more like the mobility and limb strength checks. So our head is linked to the bone behind us in the backbone. So they need to check about the mobility and limb strength checks. And then the next slide. it's the staff involved and their task distributions. So there's basically a doctor and a nurse, but there is an ER doctor and ICU doctor. The ER doctor needs to stabilize the patients and initiates emergency stroke treatment if they needed the treatment. And then they provide a detailed handover to the ICU team. It's including the diagnosis and intervention. The nurse in the ER needs to prepare the patients for transfers and they need to ensure that all the documents and equipment are ready so the doctor can check the data and communicates ongoing care needs to the ICU nurse during the handover. And the third is the ICU doctor. So in the ICU, there's also a doctor that reassesses the patient on arrival and plans ongoing critical care and monitoring. So the order necessary investigations like repeat the CT scans or the labs, and they kind of adjust treatment as they need it. The next slide, talking about the tools, they use the ECG continuously tracks heart rate and the rhythm, and which is essential for detecting the cardiac complications related to stroke and hemorrhage of the patients. And then there's a pulse oximeter, monitors oxygen saturations to detect hypoxia early. They can worsen brain injury if not handling right. And then the third one is about the infusion pumps. It's ensure accurate delivery of medications like antihypertensive or IP fluids, critical for managing blood pressures and brain perfusions. And then there's also a CTI scan result. It provides visual confirmation about the brain hemorrhage and guide the further treatment planning by the ICU team. And then the handover form. It's like the information that between ER and the ICU staff, so they can avoid errors and ensure continuity of care. And then the next slide, it's about the service users. So they're handling a patient who has experienced a severe stroke with brain hemorrhage. They need a specialized and continuous care to monitor neurological stability and prevent complications because they also have the paralysis and they need to recovery through multidisciplinary interventions by the doctors.
Okay, hello, I'm Dinda. The next is handover coordination. Handover coordination in this case is first pre-notification. In this step, before the patient transfer is carried out, the IGT team must first notify to ICU team before the patient is transferred. Second is preparing the patient. In this section, IGD nurse check the patient vital signs, which consists of heart rate, blood pressure, and oxygen. Third is define roles. In this section, to find out the role of each person. The fourth step is use the handover tool or SBAR. The SBAR method is useful for conveying information clearly. SBAR, S is the situation, B is the background, A is the assessment, and R is the recommendation. The last step is arrival at the ICU. In the section, the ICU team re-ensure that all information is correct, and the ICU doctor reassesses the patient condition and determines the next steps. Next slide. Next, there is communication. Good communication is very important in the hospital because if communication is not good, it can miss information. Tips for good communication in the hospital: first is to speak clearly and easily understood using short sentence and medical words. The second is to repeat important information, such as the ICU team repeating important information about the patient to ensure there is no misunderstanding. Third is to use written assistance or other aids such as using handover forms. The fourth is to remain calm and focused. Even in an emergency, the team must remain calm like the Ferrari crew during the race, because if you panic, it can cause misunderstanding and action towards the patient. And the last is to be polite and respectful, namely to speak politely and courteous and not to speak harshly in front of the patient or the patient family. Next slide. Next are the recommendations for care and treatment for patient recovery. The first is continuous neurological monitoring to monitor the patient brain function. The second is patient nutrition and fluid management by providing nutritional support and maintaining fluid balance in the patient. The third is support for patient paralysis and mobility, namely doing movement exercise to prevent muscle, changing the patient position to prevent pressure sores, and counseling with physiotherapy. The fourth is multidisciplinary rehabilitation for patient involving neurologists for stroke recovery and physiotherapy for muscle strength training. And the last is preventing complication in patient by having the medical teams always check the patient and be aware of infection and always check the patient blood pressure and blood condition so that blood clots do not occur which can cause ongoing strokes.
So there is uh, all from us about the situations, and thank you.